Diabetes mellitus is a chronic condition characterized by elevated levels of blood glucose, sugar, due to insufficient insulin production, resistance to insulin, or both. There are several types of diabetes mellitus, each with different causes and characteristics. Here's an overview. Types of diabetes mellitus. 1. Type 1 diabetes T1D. Description: an autoimmune condition where the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. Causes: genetic predisposition. Environmental triggers, such as viral infections. Usually diagnosed in children, teenagers, and young adults, but can occur at any age. 2. Type 2 diabetes T2D. Description: a more common form of diabetes characterized by insulin resistance and relative insulin deficiency. The body does not use insulin effectively. Causes: genetics and family history. Obesity, particularly central obesity, excess fat around the abdomen. Sedentary lifestyle and physical inactivity. Poor dietary habits, high sugar and fat intake. Age, with risk increasing after 45 years old. Ethnic background, higher risk in certain populations, such as African American, Hispanic, Native American, and Asian American. Gestational diabetes. Description: develops during pregnancy and usually resolves after childbirth. It increases the risk of developing T2D later in life for both mother and child. Causes: hormonal changes during pregnancy that affect insulin effectiveness. Obesity and a history of gestational diabetes in previous pregnancies. Monogenic diabetes. Description: a rare form of diabetes resulting from a mutation in a single gene. This includes conditions like maturity-onset diabetes of the young and neonatal diabetes. Causes: genetic mutations that directly affect insulin production. 5. Secondary diabetes. Description: this occurs as a result of other medical conditions or medications that impair insulin function or secretion. Causes: conditions such as pancreatitis, Cushing's syndrome, or certain tumors affecting the pancreas. Side effects of medications, such as steroids. Summary of causes. Genetic factors. Family history plays a significant role, especially in type 2 and monogenic diabetes. Lifestyle factors, physical inactivity, obesity, and poor dietary choices are leading contributors to type 2 diabetes. Autoimmune factors. Type 1 diabetes is primarily attributed to autoimmune responses. Hormonal changes, particularly relevant in gestational diabetes. Medical conditions and medications. Certain health conditions and drugs can lead to secondary diabetes. Understanding these types and their causes is crucial for prevention, early diagnosis, and effective management of diabetes mellitus. Regular monitoring, a balanced diet, physical activity, and medical intervention when necessary are vital components of diabetes management. Diabetes mellitus is diagnosed through a combination of symptoms and diagnostic tests. Here's how you can recognize and confirm it. Symptoms of diabetes mellitus. Common symptoms: increased thirst, polydipsia; frequent urination, polyuria; extreme hunger, polyphagia; unexplained weight loss; fatigue; blurred vision. Additional symptoms, particularly in type 2 diabetes: slow healing sores or frequent infections; darkened skin in certain areas, such as the neck or armpits, athosis nigricans; tingling, pain, or numbness in hands or feet, neuropathy. Symptoms in severe cases: ketoacidosis or hyperglycemia; nausea or vomiting; fruity smelling breath; confusion or difficulty concentrating. Diagnostic tests for diabetes mellitus. Fasting blood sugar tests. Normal, below 100 milligrams per deciliter, 5.6 millimoles per liter. Prediabetes, 100 to 125 milligram per deciliter, 5.6 to 6.9 millimoles per liter. Diabetes, 126 milligrams per deciliter, 7.0 millimoles per liter or higher on 2 separate tests. HbA1c test hemoglobin, Measures average blood sugar over 2 to 3 months. Normal, below 5.7%. Prediabetes, 5.7% to 6.4%. Diabetes, 6.5% or higher. Random blood sugar test. Diabetes, 200 milligrams per deciliter, 11.1 millimoles per liter, or higher with symptoms. Oral glucose tolerance test. Measures blood sugar 2 hours after drinking a sugary drink. Normal, below 140 milligrams per deciliter, 7.8 millimoles per liter. Prediabetes, 140 to 199 milligrams per deciliter, 7.8 to 11.0 millimoles per liter. Diabetes, 200 milligrams per deciliter, 11.1 millimoles per liter, or higher. Urine tests. Checks for glucose or ketones, which may indicate diabetes. Next steps. If you notice symptoms or have abnormal test results, consult a healthcare professional for proper diagnosis. Early diagnosis and management are crucial to preventing complications like heart disease, kidney damage, and neuropathy.